everyone. I'm Vanshika McCall, pursuing my master's at IIC Bangalore. We have with us today Dr. Nitish Mahapatra, Professor at Department of Biotechnology, IIT Madras. A very warm welcome to you, sir. Welcome to Treat DM 2025.
Thank you.
To begin with, your research team has identified key genetic variants linked to higher risk of diabetes and cardiovascular diseases in South Asian population. How can these findings shape the future of preventive healthcare and personalized medicine in India?
Yeah, so discovery of the genetic variants, particularly in the South Asian population, is extremely important because most of the genetic studies, those who are done in the other populations, such as European population, may not be relevant for the Indian population. In our studies, we have seen that there are certain genetic variants which occur in the Indian population. Their frequency is drastically different as compared to the European or other Caucasian populations. So, which clearly indicate that we should have our Indian set of data, genetics data, which would be relevant for the Indian population as well as South Asian population. So, therefore, discovering the genetic variants in the Indian population would be of immense value. And this discovery can actually lead to the association with the various disease conditions, including the cardiometabolic disease states, which can provide future personalized medicine. Because if we see that certain variants are present in type 2 diabetes population, then it could help in early diagnosis, and eventually early diagnosis is critically important for metabolic diseases such as type 2 diabetes, since a lot of people who have diabetes, they don't know that they have diabetes. So therefore early detection is going to be extremely important. And genetic-based, test-based studies could play actually a very important role in that direction.
That was quite relevant. Looking ahead, how do you envision your genetic research translating into routine clinical practice?
Yeah, that is going to probably take some more time because the current genetic research, although a part of it, particularly for some diseases such as breast cancer, people have started utilizing the genetic variants for the detection. But for other diseases such as metabolic diseases, although there are some companies which are coming up with like genetic panels where they have certain variants and then they give some sort of risk score that, okay, if you have this particular variants, you are likely to be at higher risk of say type 2 diabetes or other associated conditions. So, but this has still not reached the stage where it could be applied in the clinic. But I hope in near future it should be applicable in the clinics as well, since the cost of overall detection of the genetic variants is actually going down. It has drastically reduced over the first few years. So there is a good potential that these studies will be applicable in the clinic in near future.
Okay, since we are here, how effective do you think platforms like TreatDM are in fostering a collaborative approach between healthcare and research?
Yeah, TreatDM or similar kind of platforms are extremely important because it brings together the clinicians and basic scientists as well as other technical expertise people together. So this definitely provides a kind of golden opportunity for both the basic scientists to interact with the clinicians as well as clinicians to provide kind of inputs on certain research areas where they might have seen certain kind of disease conditions, but they don't understand what is the molecular mechanism for that. So here there is a good opportunity that kind of comes up for collaborations and future discovery for certain aspects of these disease conditions, which may provide molecular basis for different disease states.
Lastly, what advice would you offer to young scientists and clinicians who aim to bridge between fundamental discoveries and practical therapies in metabolic disease research?
So yeah, my sort of suggestion to the young researchers, both in the basic science as well as clinical aspect, would be it's kind of most of these discoveries kind of take time. So from our own experience, I can say that sometimes it takes years, maybe 5 years or 10 years time to build the cohorts, because most of the metabolic research requires not hundreds, actually thousands of people. So you have to bring both the control people and the diseased people, bring those cohorts. So it takes actually long time. So they should not be impatient and think that, okay, we'll just get the data in some short period of time, 6 months or 1 year. That usually does not happen. So you need to build the cohort properly and then systematically characterize those both at the clinical level and also the cellular and molecular biological level, because one basic constraint, or I would say limitation, that I see particularly for the clinical data is that many times these are collected by people who are not the actual clinicians. These are often done by some assistants kind of thing. So they may not understand the importance of accurately collecting the data and also samples from the patients. So that part the clinicians must sort of try to sensitize their assistants that the data should be collected accurately. And because without the accurate data, if later on those samples are utilized to analyze certain molecular or genetic aspects, that won't give the exact anticipated kind of results. So that is kind of extremely important. Both the basic researchers as well as clinicians should give priority towards collecting a good cohort of samples and also spend time in accurately analyzing the data. So eventually that would be the kind of giving rise to clues, or rather methods or new technologies towards alleviating the metabolic diseases.
That was truly helpful. Thank you, sir, for your precious time and valuable insights. It was pleasure having you here at Treat DM 2025.
Thank you. Thank you so much.